Our plan was to use the time that Plan B gave us to give ourselves extra power in our fight against Omicron. This plan has worked, and the data shows that Omicron is in retreat. Today's ONS data shows a fall in infections, including in older age groups. Hospitalisations have also fallen over the past week, and the number of patients, COVID patients, in intensive care beds is now at the same level as it was back in July. I've always said that we would open up the country as soon as the data supports it. And earlier today, that's why we announced 3 important changes as part of our return to Plan A. First, starting immediately, the government is ending the guidance on working from home. And I know that many people have already started talking to their employers about making arrangements to return safely to work. Second, from the start of next Thursday, mandatory certification based on vaccines and tests will end. But of course, organisations can still choose to use the NHS COVID Pass voluntarily. Third, also starting next Thursday, we'll no longer legally mandate the wearing of face masks. But we must suggest that they are worn in enclosed and crowded places, especially where you come into contact with people that you don't normally meet. These changes will take effect sooner, even sooner, in classrooms, where we will no longer require face coverings from tomorrow, and the Department of Education will shortly remove the guidance on their use in communal areas. As well as these changes, we're also exploring where else we can ease restrictions. We're looking to replace legal requirements on self-isolation with guidance and advice, and in the coming days, I'll be setting out our plans to further ease restrictions on visits to care homes. The steps that we've announced today represent a major milestone. But it's not the end of the road. And we shouldn't see this as the finish line, because we cannot eradicate this virus and its future variants. Instead, we must learn to live with COVID in the same way that we've learned to live with flu, and we'll be setting out our long-term plan for living with COVID-19 this spring.